Hello, everybody. We'll get started here in less than a minute. Welcome, welcome. Come on in, find a seat, make yourself comfortable. Okay, that's the top of the hour by my watch. Good afternoon, my time, and welcome. My name's Alan Barr, the COEH Northern California. On behalf of the NIOSH-supported education and research centers throughout the country, we're pleased to present the 2022 ERC Ergonomics webinar series, where we offer free monthly webinars on various topics on human factors and ergonomics. This collaborative effort on behalf of each ERC's continuing education program aspires to provide access to current research supported through NIOSH ERC programs. Thank you for joining us today. All participants who logged in with their registration email will receive a link to the recording and an evaluation form that will qualify participants for a certificate of completion worth 1 continuing education contact hour. An upcoming webinar next Wednesday, Protecting Essential Workers Beyond the Pandemic, Insights from Research and Organizing. You may register for that and other upcoming webinars at coeh.berkeley.edu/webinars. That's coeh.berkeley.edu/webinars. For today's webinar, you will be muted during the presentation. If you'd like to ask questions, and we do encourage you to do so, please enter them into the online Q&A box, and we'll save some time at the end of the presentation to address those questions. Today's webinar will be recorded and made available along with past webinars on the COEH Northern California YouTube channel. Do us a favor, please like and subscribe to help us to continue to grow that channel. For today's webinar, entitled Ergonomics for Total Worker Health, What is the Current State of Knowledge? Presented in conjunction with New York, New Jersey Occupational Safety and Health Center, an ERC. Our speaker today is Dr. Katia Costa-Black. Dr. Black is a faculty lecturer at the graduate program of Ergonomics and Biomechanics at New York University, and at the School of Health Systems and Public Health at the University of Pretoria in South Africa. She also serves as an independent consultant in the area of ergonomics and total worker health. Dr. Costa-Black brings an international research-oriented and multidisciplinary perspective to her teaching and ergonomics practice. She holds a PhD in industrial engineering, a master's degree in ergonomics and biomechanics, and a bachelor's degree in physical therapy. She is serving as the American Industrial Hygiene Association Total Worker Health Liaison, and recently joined the Executive Council of the Puget Sound Human Factors and Ergonomics Society. And with all of that, it's my pleasure to hand the mic over to our speaker for today, Dr. Costa-Black.
Thank you, Alan, and hello, everyone. It's a pleasure to present this topic, and thank you, the COEH, for this opportunity. And I want to go right into it. And my main objective today is to first explain why total worker health matters and what are the key elements for total worker health. Then I will share with you some preliminary results from a scoping review on ergonomics research for total worker health. And finally, I'll be discussing what I found as knowledge gaps and future directions for ergonomics research. And presenting a little bit of a background, changes taking place in the modern workplace, such as more flexible work arrangements, forced workforce migrations, flatter management structures, and non-traditional employment practice have altered work organization factors and raised concern about many negative influence on worker health and safety. These challenges call attention to the need for multi-level interventions to counter these effects. Research to date has focused primarily on individual level interventions with far less attention to interventions at the policy level, the employer, the organization level, and job design level. As we have seen with the COVID-19 pandemic, many public health issues have come to the surface and persistently enter the realm of work and affect our health and well-being. We will be experiencing more changes and complex situations with the effect of climate change and its impact on many workplaces. But even before the pandemic, many scientists have noticed that no longer we are able to perfectly separate workplace risks from social determinants of health. This is mainly because work is a determinant of health in itself. We have, unfortunately, for a long time, compartmentalized so many workplace problems by developing many occupational safety and health programs that may address, well, one particular issue, but it's not enough given the needs of workers and the needs of globalization production. And in this reality, we see many ergonomics interventions as silos and not well integrated to management systems and organizational structure and culture. We definitely have turned towards data-driven practices on occupational safety and health, and that is beneficial for everyone, but we still have not yet recognized the voices of many workers. We have made too little efforts at the level of meaningful workplace policies for total worker health. So by recognizing the need for a more robust approach to address these workplace issues of today, in 2011, NIOSH has proposed the total worker health approach, which is defined here as policies, programs, and practice that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. One of the interesting aspects of total worker health approach is that it has been developed on the premises of implementation science frameworks to help bridge the gap between research and practices. And there have been great efforts by many NIOSH total worker health centers of excellence to empower organizations to adopt evidence-based practice in total worker health. Now, you may see why it matters, but the best way to recognize its importance is to reflect on the influence of work on well-being and to examine the idea that life on the job and outside are deep interrelated in terms of health and well-being. More and more organizations are recognizing, considering that when human capital is valued, workers are empowered and feel more responsible for their behavior. As a result, it's clear that the need of a robust approach to bring total health to all workers. We can identify a number of global organizations that are talking about the same thing. Maybe they use a different terminology, and some of them for quite a long time. And but I want to bring attention to these three main global initiatives, in particular, the WHO Healthy Workplace program that was launched in 2011. And then again, recognizes similar premises for addressing health and safety and well-being. The 7 goals of the International Social Security Association that talk about Vision Zero campaign that had been launched since 2017. And very new this month, we see on the International Labor Organization that we have all the member states have decided to commit to a new resolution that really talks about a healthy working environment. even though we have this great momentum, and we also need to recognize that we are far away from achieving a healthier workforce for all workers, and we need to advocate a lot more for this. One way we can do as researchers to pay closer attention to health inequities and disparities in the realm of work, because they really matter. And as we see in the statistics showing on the ILO website, most workers still lack basic protection from unsafe work conditions, and we have a very high rate of number of work-related accidents and disease spread all over the world. And we know that total worker health, or if you wish to call healthier workplaces, makes sense from a social ethical point of view, as well as from a financial point of view. And the question is, how can we get there? NIOSH has defined 5 elements for a total worker health programs. And the 5 elements are the leadership commitment. Then it's important for organizations to recognize the relevance of addressing health and safety, and including commitment to health and safety and well-being. The second elements is the reduction, risk reduction, and by designing work to eliminate or reduce safety and health hazards, we are promoting, and also to promote worker well-being. The third defined element is to promote and support worker participation and consultation from different level. The fourth one is the privacy of workers that should be ensured and addressed throughout the program. And the integration of system is a key aspect of total worker health, because the intention is health promotion and health protection are well integrated with the goals of the program. I want to highlight that some of these defining elements have great similarities with the ISO 45001 Occupational Health and Safety Management System program. And this is why with these elements, we can understand the need to address and present more robust programs. And that's why it's encouraged that for developing a total worker health program, we need to give priority to eliminate at start work conditions that are threatening the safety, the health, and well-being. So NIOSH present this hierarchy of control for total worker health, which is being utilized by many studies who are recently implementing this approach. The unique part of this hierarchy of control is that the total worker health program must address these control first before they look into other aspects. And there are, to summarize some of the points I just made and move towards some of the results from the review that I completed, the preliminary results, I want to just make a synthesis of what I just said just now. So we understand the importance of total worker health, and by bringing that idea of integration of practice is what we are trying to enhance the aspects of health and well-being in the workplace. The idea of addressing hazards and designing work and tasks to eliminate these hazards, it's still a very core aspects of the program. The other aspects is how it brings cross-disciplinary work, and the idea that different departments within organizations should be collaborating in understanding and integrating these practice as a more uniform activity. And the other aspects that's very relevant is to enhance and promote the collaboration and support of workers and their participation and feedback throughout the program. So moving to what I had completed as mapping the literature, the goal of this study was to map the literature by asking the main question: what is known from the literature about the application of ergonomics for total worker health, and what are the research gaps? in order to complete the study, I use a methodology from my scoping review, and I will be working on finalizing results and publishing results pretty soon. This study has criteria selection from 2012 to now, because that's the time when NIOSH had advanced with the recognition of the word total worker health. And another criteria for inclusion is that it must meet the criteria of being within the scope of ergonomics according to ergonomics definition. And the third criteria is the studies must target the minimum of 2 total worker health issues across different categories that I'll present to you in a second. And the exclusion criteria were opinion papers, historical theoretical papers, and literature reviews were excluded. So as I mentioned, the scope of the ergonomics that we're looking at is definition by the International Ergonomics Association is that ergonomics is the scientific discipline concerned with the interactions among humans and other elements of a system, and the profession that applies theory, principles, data, and methods to design in order to optimize human well-being and overall system performance. So as most of you know, ergonomics is a multidisciplinary scientific discipline, and we are looking to designing for optimization for well-being and overall performance. These are the issues that are relevant to advancing total worker health that is presented by NIOSH. And you see here that there's dividing by categories. And in orange, you see the categories of prevention, of control and hazards and exposures. A lot of these issues are, some of them are related to ergonomics, others are not. And then you see other issues here related to work organization and related to work arrangements, workforce demographics. So it's these issues might be interlinked with different professional practices, not just ergonomics, but I use these references when I start mapping the literature. The intention was just to retain studies according to these that has at least 2 of aspects of that. So as the results, what we found is that we applied the criteria, as I mentioned, based on the scope of ergonomics and must target 2 relevant total worker health issues, as I mentioned. And we found the studies are within 3 main themes. The first theme is the ergonomics design for total worker health. The second one are aspects of macroergonomics and participatory ergonomics are predominant. And the second one, the third one is the opposite. This is this third one, and the second one is the stress management and work-life balance as it related to job redesign. And so we identify a number for this particular theme, ergonomics design for total worker health. I have identified 60 studies, and I had mapping according to these ergonomic issues. And we can see that most of these studies were done for industries, office environments, and one was within a manufacturing environment. It's mainly done in the United States of America, and the issues that they're looking at in terms of integration of health promotion and health protection would be related to building and design, prevention of musculoskeletal disorders, issues related to prolonged sitting, and reducing health risk associated with sedentarism. So most studies identifying this first theme present the idea of an active workplace as a solution to health promotion and health protection. Some of the benefits and resources are listed here on this figure on the right side. And we know that when the design allows for more dynamic movement, avoiding a static posture, etc., the general health and well-being are expected to improve. But at this point, we cannot state that we have strong evidence on how this can reduce musculoskeletal occurrence and symptoms. Given that we are in the very early stage of research in ergonomics for total health, our scope and review only mapped the topics, and we didn't use a rigorous quality appraisal process. However, I have identified that researchers Perry and her colleagues conducting in 2019 a Cochrane review and found limited evidence on the effects of sit-stand for reduction of musculoskeletal disorders, possibly due to small sample sizes and study design flaws. Still, we know that many negative effects of sedentarism, and it is important to consider that active workspaces for most people can be very beneficial. The only spin-off is that those design solutions are not one size fits all. Workers need training, and also they need to be engaged in this type of design decisions. Employers also need to pay close attention to how inclusive is this type of design. Moving to the second theme, the stress management and work-life balance team, we have identified only 3 studies that are specifically meeting the criteria. And we found that the studies were covering aspects of biological agents, such as sleep disorders and sleep patterns, reducing ergonomic stress in relation to workload and fatigue. And another study looking to the combination of different aspects of job redesign for improving the workload and decreasing the workload for employees in a healthcare environment in Canada. I want to cross this. Okay. Sorry. These 3 studies have a few things in common. They talk about stress management in relation to these 2 main aspects. One is job redesign, and the other one is design for psychological health. So essentially, I conclude that these studies kind of present and map the information on ergonomics in terms of that, but it gives us information that there are a lot of more to be done in regards to evaluating these examining effective studies on the implication of stress management and job design. But I want to emphasize that one aspects of job design is that they aim to address some of the work conditions that can lead to stress by making changes in the job structure and whenever it's possible. And the other is they utilize the prevention through design principles for improving psychological health. And for that, there are several design solutions that they propose, such as green spaces, consider cognitive needs and demands of workers, strive for decision latitude and support from supervisors, use design models at different stages of the design process to stimulate the workers to give ideas and foster ownership. The third theme, and is the one that I encounter most of the papers, is macroergonomics, and as a part of one of the methods of macroergonomics is participatory ergonomics, and some of them have that emphasis. So I had identified 90 studies within this theme that meets the criteria, and this particular team, it's important to pay attention to how robust and comprehensive they target issues related to training, leadership, issues related to policy changes for focus on well-being and center on issues beyond ergonomic factors, and they look into healthy eating and increasing recreational activities. Some other studies here have proposed toolkits that are being, and I'm going to describe that in a little bit more details in a second. And so these studies cover different, mainly in the United States. They cover a lot of industry, the ones that tested and tested a toolkit. And I'm going to describe how this program is done. But essentially, what I identify is that they really had comprehensively look into how to implement a total worker health program using ergonomics, macroergonomics principles. So this is pretty much an example of one of these studies. And example of the application of this study is in relation to participatory ergonomics for total worker health. This one of the tools has been developed by the Center for the Promotion of Health in New England Workplace, the CPH-NEW, and it's called the IDEAS tool. And the tool is the Intervention Design and Analysis Scorecard. They offer training on using this tool and how to use it. They provide also necessary toolkits and all the necessary equipment that they need to do this thing and training. But they also state that they require ergonomics expertise or design expertise to conduct this particular program. The second tool that was identified during the literature search is the ergonomics climate assessment tool. It's also based on macroergonomics principles. It contains information related, it's 40 questions, and it contains information on management commitment, employee involvement, and job hazard analysis and training and knowledge. In addition to the 18 studies that were mapped and presented within these 3 different themes, one study presents a total health framework and was not included because it's a theoretical study, but I want to share with you because the framework presents characteristics of the approach that are ground and core fundamental human factors and ergonomics principles to improve well-being. There are several studies that are being tested using the same framework for healthcare, for the food industry, and from one other that has used this exact same framework to present the integration of total worker health program. And a reflection from these preliminary results is that there is also a need for discussing how integrated a total worker health program should be. A guide for that is presented by the researchers from the CPH-NEW in New England, where they propose 4 criteria to determine how integrated the program should be. And the first criteria is the coordination of goals and activities between the occupational safety and health and the health promotion functions. And an example of that is using a common reporting structure and systematic examination of how risk factors from the 2 domains interact with each other. The second criteria is the assessment activities and are designed to identify both work and non-work hazards. The third is the interventions they are seeking to prioritize mitigation of workplace contributors to poor health, safety, and well-being, such as improving organizational safety and health policies and practice to make the workplace health promoting. And the fourth one is participatory engagement. And then it's to empower workers to collaborate and to prioritize goals. So these are the criteria that we can look at and reflect on when you consider implementing a total worker health program. And moving to some of the gaps that were identified, for me as a consultant and researcher, I have immensely appreciated the efforts done so far, but we of course have a long road ahead. In order to examine some of the research gaps and advances in the contributions of ergonomics, I look at the NIOSH's Future of Work Priority Topics, And my observation is that we see a booming of ergonomic studies on emerging technologies, robotics, and even some promising solutions for the aging workforce. But so far, these solutions are presented in silo, and there is very little consideration for more integrated total work health approach. We found one ergonomic study that integrates aging shoes with health promotion and protection. The intention of presenting this priority topic is to connect trends in the workplace, work, and workforce changes to prepare for future of occupational health and safety. And then finally, and as such, another important gap is how we can be more inclusive in designing workplaces and how we are addressing diversity issues that are emerging now. So how can we look at design with a social sustainability lens? And the results of this scoping review show some utilization of macroergonomics principles and the participatory ergonomic approach for total health. For those of you not well familiar with macroergonomics models and methods, they are not new and largely utilized in manufacturing and healthcare. And the greatest advantage, in my opinion, is that with some developed methods, we are able to capture a multi-system level understanding of organizational design structure and culture in relation to individual outcomes, such as performance, stress, and injuries. And for total health, the direction I suggest is to validate some of these existing methods and tools instead of having to reinvent the wheel. They can be useful in address complex system level workplace issues. I think many ergonomists lack the training on how to operationalize these methods, and there is room for further development there. The methods I'm referring to essentially are organizational questionnaire surveys that can be useful at several stages, for instance, in evaluating stresses in a job, in benchmarking organization on key characteristics of interest, in evaluating the impact of technological and organizational changes on human factors characteristics, and in monitoring workers' opinions during the implementation of a technological changes. And I can provide some references and examples once after this presentation for whoever is interested. And to conclude here, I want to first acknowledge the effort again that most of these research has done to accommodate, to really integrate health promotion, health protection. The total occupational health perspective is an opportunity to really unravel system level issues. It is not easy to be done. So far, ergonomics research has contributed to a broader view of workplace design improvement for injury prevention and well-being, to job redesign for reducing stress, and to support organizational changes vis-a-vis participatory approach and social technical system improvements. There are, of course, more to be done. And my suggestion is to consider the 6 indicators of integration when developing any type of total work health program. There's the one that I presented, the 4 criteria indicators is also another one to consider. This is a second one that you can consider as integration. And another direction is to look in terms of ergonomics research on emerging technologies, on aging workforce, inclusive design, and vulnerable population, and how that, that research should be considering some of the elements of health promotion and total work health, and to avoid silo approach. And I also want to share with you that there are many opportunities for certification and training. The slides will be available, and these are hyperlinks that you can click and find the resources there. But from the direct from NIOSH, you will see a list of resources such as webinars, symposiums, on-demand training, and certificates. And a good start point if you are new to total work health is to read the NIOSH Fundamental of Total Work Health Guide. It's very, very useful. And I will stop here and leave you with a quote from the father of transdisciplinary thinking, and I will take your questions.
Thank you very much. That was an excellent overview of total worker health. We're definitely a little ahead of schedule here, so there's plenty of time for some questions. I have one here that says, how do you see something like the WELL building standard fitting into total worker health?
I'm not too familiar. Be well.
It's WELL building standard. Bob, if you want to shine some more light on that question, I'll rephrase it. I could repose the question. Let's go to another one. What can be done to address the mentioned silo approaches identified?
Yeah, so that's pretty much what the main message that I want to give in this presentation is that it was difficult to identify ergonomics research that are addressing issues of workplaces of today without a silo approach. And I have to say that a lot of out there really demonstrate that it's either one aspects of the other, not integrated. So I think one way of doing it is to take this step of identify and doing a needs assessment of looking to what organizations need to address in terms of health protection and health promotion before delving to doing more. But I think that's pretty much as the first step. And if a program is designed to look at carefully into how they should be considering these aspects of leadership commitment, the aspects of participatory and engagement with the workforce and other aspects, and consider these as kind of criteria for developing a program.
Okay, I have one for you. Because you included policy in this. 4-day work week. I'm wondering if in your travels if there's any research surrounding the 4-day work week and its effect on total worker health.
Oh, 4 days a week work week. So there is to my knowledge, I actually know that there is some studies done in, if I'm not mistaken, in Finland, that look into productivity in relation to work hours. And then I think they just published something not about the 4 days, but reducing the week hours to 30, from 40 to 30. And then I could share with you this study. And they show that this particular study is being kind of in the news in Europe, as I know, and it's being interesting to see that this, of course, has implications for policies, because obviously European countries have kind of different work arrangements. But I definitely see the scientific, I would say, solid information there to inform policies for changes in that regards, because this is particularly study that I'm talking about, which is very new, that shows that a worker can be as productive for 30 hours a week versus 40. They show that it's very strong evidence for that. So I think this can inform policy changes for sure.
Yeah, I know it's not a new concept, but given the focus on total worker health, it seems like something that perhaps should be studied carefully. Another question here, how can we better incorporate workers' perspectives into participatory ergonomic practices in considering the total worker health approach? And how do we get improved management buy-in?
Oh, those are really good questions. The part of participatory, and I think there are a lot of information on how you really can empower workers to have a voice and do, and not feel intimidated by speaking about what needs to be done. And I think there is a lot of research done today on what are the steps that are necessary to achieve that. There are issues about privacy of data, health data that we have to consider when we developing a participatory approach. For total worker health in particular, I really like the ideas tool has a whole structure and process in place that you can follow through. And it has considerations for different steering committee within the organization to participate at different levels. So giving kind of a awareness procedure before you actually delve into making changes in the workplaces. I think this is a really careful and thorough process to go through. If you are interested in applying a participatory approach, I highly recommend that you take a closer look to the ideas too from CPH New. And there are other procedures similar to it, but there's advantages of using data-driven approaches that look into root cause analysis and look into aspects of the workplace that can be done with prioritization of issues. There are all kinds of ways of doing this well. From the scientific point of view, in total worker health, I think what we have now, it's a really good and solid structure about how to really bring participatory way and give the workers the voice by using these tools that I just mentioned.
Okay, thank you. The earlier question relating to building standard, apparently it's similar to the LEAD program and BREAM, that's performance-based system for recognizing features of buildings which impact the health and well-being of their occupants. And so with that, the first question was, what do you see, how do you see something like this program, this building standard, the WELL building standard, fitting into total worker health? Is that something that you have read about?
Yeah, I'm interested in know more about it. It made me very curious. Facility design and aspects of design in terms of green spaces and all that, it's not yet in the topic that we read on total worker health. As far as what my research shows, there is very little conversation and discussions on the aspects of building facilities for wellness and for well-being. I think there is an intention to expansion, and I think there's future directions for research that should be looking in terms of how these designs can really impact on health and well-being, if that's what you're referring to. But if the participant that asked this question can share with me some information, I would love to read some particular issues on this that I'm not too familiar.
Excellent, thank you. Another question for you. Do longer work shifts, 10 or 12-hour work shifts, fit within the total worker health concept, or is there not a good way to design them to be healthy for workers?
Well, there was one of the studies that was evaluated that looks in terms of changes in a work shift for nurses and how that impact, and it was considered from a holistic total worker health view, with other changes, not only in the schedule, but also on supporting from supervisors, on changing the, not just the hours of work, but making other changes. The trouble we have, and I would say from the research point of view trouble, is that when we looking and evaluating these multi-level interventions, we are always really going to look into what is the effect of one particular change if multiple changes are implemented. And there is this particular study was an intervention study, and the effects that were measured were not enough to say, well, it's a solid information and making changes in this way can be positive. But I would say that in the European countries, again, in Scandinavian countries and Denmark, and some collaboration research that I've done in Sweden, we look in terms of sickness absence and presenteeism and how that impact on work hours. And definitely that had a big impact. I'm not too sure we yet have the knowledge, the scientific knowledge on the long hours of work in relation to wellness and well-being. I highly recommend, if there is researchers on this call, to look in terms of the NIOSH developed a well-being questionnaire, which I didn't have a chance to mention. And this well-being questionnaire should be used, across comparison studies to really identify these issues. And I think it would be an excellent type of work to compare these hours of long hours versus shorter hours, and compare the well-being and measure the well-being. We don't have yet that information to really be, I would say, very precise and say this is the amount of hour that people should be health and keeping it a health state. We don't know that yet.
Understood. Thank you. Here's another one for you. How do you evaluate total worker health programs in the workplace? Are they generally assessed via engagement surveys, or are there any other lagging, leading indicators?
I don't know fully all the measures and metrics that they use for doing it. I know that process evaluation, and especially if you're doing something like the ideas to method of participatory approach for total health, you have those metrics there. And I know that there's no leading indicators developed yet, but we have some metrics of understanding on, of course, aspects of health and safety that can be measured. But I think the best bet is to really look in terms of now this new questionnaire that was developed by NIOSH not too long ago on well-being, that includes some of the total worker health principles.
Thank you. Do you have you come across in your research any artificial intelligence being leveraged to identify total worker health issues, or perhaps solve problems with respect to total worker health?
No, I have not. Unfortunately not. I think there's potential there too for more work. No, I don't know much about it. I think there are, in terms of biometrics and cardiovascular disease metrics, might be some research done. I'm not too familiar with those, I have to be honest. But I do think there are some intention to expand the understanding of total health and the use of these new ways of doing work.
Okay, thank you. Yeah, I think that might be coming down the pipe before you know it. We shall see. Here's another question for you. Do you have any examples of real types of interventions, ways to address improved stress management and mental health, issues that are intrinsically linked to total worker health?
Yes, yes. I mean, I talk a little bit from the point of view of ergonomics, the idea of design for psychological health, and some ideas that for me as an ergonomist, I see a lot of it is how people are not aware of how changes in support from the sides of supervisor support and from the side of organization support matters for people with mental health. There are some of the centers for centers of excellency of NIOSH. They are specifically developing tools that are more for to address mental issues in the workplace. I know one particular tool that was developed by the Oregon Health Workforce Center, and it's called the SHIP tool. Is a safety, health, and improvement training tool. maybe I'm program, and it's to train supervisors to identify some of these issues, mental problems that employees can have. And so it's to help supervisors to easily address these issues and how they can overcome some of the challenges that they may encounter with some mental health problems. And from the total health point of view, the one that I comes into my mind is this one that was developed by Dr. Leslie Hammer here in Oregon.
Okay, thank you. At the beginning of your talk, you mentioned some high-level sort of policy bodies surrounding total worker health. You know, I don't know if you recall, it's the ISSA and ILO and so forth. I'm wondering if there's any sort of formal coordination between those strategies. Is there some sort of overarching coordination?
Well, yeah, well, I know a little bit about these organizations for different reasons. So I live in many different countries, and I was a UN diplomat for a while, but I do believe that these organizations, especially WHO and ILO, they coordinate their efforts very well. Of course, they have different agendas, different priorities. And I think if it's a global level type of campaign or initiative, like the ISA one, the International Social Security Association, they are independent of each other. They launch their own and they promote their own way. But I think what they try to do is really look in terms of how this is aligned with large organizations. And from the point of view of sustainable development goals that has been developed by the UN, there is a really good synchronous activities happening between what ILO does for decent work, for instance, and what they promote as decent work for all, and what the UN Sustainable Development Goals define as decent work. So there are some level of coordination. The European Agency for Health and Safety has some activities that are pretty much independent, but they also have been talking about these issues on well-being and health in the workplace for quite some time. And I think they have different aspects that they address at different time. Like there was 3 years ago, a very large campaign about aging workforce and how to really look in terms of that, and incentives for research on that area really came into place. But I think this is in a global level, the more the merrier. So we want all these organizations to talk about the same thing. And I'm glad so far that there's a lot of, maybe the language is not exactly the same, but we see more and more a kind of a synchronous idea that these ideas of healthy workplaces will benefit employers and will benefit society as a whole. So I think, and workers, of course. So I think that's a very positive thing, that they are not just doing by themselves, but they might have, they launch their ideas on their own, but there's really good synchronous ideas there.
That makes good sense. Thank you for that answer. Okay, I think we will give one final thank you to you, and I'll close by letting people know that you can learn more and register for our upcoming events at coeh.berkeley.edu. You can also subscribe to our YouTube channel, as I mentioned, where you can find recordings of previous webinars and other events. And as a reminder, all participants who logged in with their registration email today will receive a link to the evaluation form that will qualify participants for a certificate of completion worth 1 CE contact hour. If you have any questions for us here at COEH Northern California, you can drop us a line at coehce@berkeley.edu. That's coehce@berkeley.edu. We'll be happy to answer questions for you. A big thank you to our presenter today and to everyone who joined us for the webinar. We will see you at the next one. Thank you so much, Dr. Costa-Black.
Thank you. It was my pleasure. Bye, Alan.
Bye now.